Hello and welcome back. Like I said, I wanted to do another video after Christmas because both Brooke and I are recovered now. So I warn you, warning, it is going to be a long video. I want to do how to take care of a sick baby, like an update, and then I also want to do a review on the products I said I was going to review, and then we'll see how much time I've consumed, and we'll decide what to do from there. So welcome back, Happy New Year, Merry Christmas, Kwanzaa, whatever you celebrate. As you can see, I have Brooke here with me. She's rearing and ready to go. So this post is really important because I actually have a lot of friends now who are having children, and I feel like I'm somehow an expert. But I wanted to have some way to help people take care of their sick babies because I see that a lot of moms don't know how to take care of a sick baby, with like what to give them, what not to give them, how to help them breathe, like all kinds of things that I didn't know, but I had to learn. When she was 3 months old, she got spontaneous pneumonia. I don't even know how she got it, neither do the doctors, so it was kind of funny. And now, right in the middle of 6 months, like she got RSV pretty bad, and that was from daycare. No blame to her daycare provider. She was doing her most to keep her healthy, but daycare is technically called a petri dish according to the nurse when I took her to the ER. So petri dish away, but she got really, really bad RSV. She was extremely congested, like I could hear her wheezing out of her lungs. She had so much nasal congestion, it wasn't even funny. She was tired. She just all around didn't feel good. She just burped. She would not sleep well. She would sleep a lot. She would sleep a lot, and she just was generally like a sick baby. So I took her to the hospital. They diagnosed her with RSV, and then they said, we can't do anything to help you. You go home, help her out, give her warm showers, etc. So this is my advice on how to help a sick baby. With sick babies like RSV, pneumonia, like colds, it's obviously going to happen. She apparently is trying to help. You want to help their airways stay clear because if it gets in their chest, then they will have to be hospitalized. So, how my favorite thing in the whole wide world, and I know some moms don't like this, but I liked it, is, let me find it, this guy right here, the sucker they give you from the hospital. I love this thing. This thing has helped me suck out so many boogers. It's not even funny. They'll teach you how to use it at the hospital, or at least my hospital did. But you just like push it and then stick it in their nose and release, and it grabs anything and like pulls it out. You don't want to like shove it up their nostril or anything, but just in the like right here, so you can grab anything that's there that's hindering their nose and pull it out, because I was told that babies up until like a year old are primarily nose breathers, so that's a big thing for them. Another thing that I found was super, super, super effective when she was sick, and this was um, by my, I was told this by my doctor. She's awesome. Is this stuff right here. It's, let's see if I can turn it. This is amazing stuff. It's completely natural, and they can have it. I don't know if you can see it, but look, it's 2 months plus. So it's a completely natural, completely safe, and it actually helps decongest, and it helps them with a cough. And things like RSV cause cough. I mean, even a small cold causes a cough. So for Brooke's age, it even gives you the ages and the dosages on the back. She got a 4 milliliter dose, which was like this much, and it's a natural grape flavor, which I found is exceptionally sweet. So I just mixed it with her bottle, and she seemed to really enjoy it that way. I would also, per my doctor, you should always consult your doctor on everything, would give her the pain relief and that seemed to help break her fever. If you have to, call your doctor or talk to your pharmacist about the correct dosage. Some babies weigh more, some babies weigh less. I give my daughter the smallest dose possible, and it really, really works. Another thing that was super, super, super helpful, when I absolutely love it still I use it, is Baby Vicks. It's like the best thing in the whole entire world. And it doesn't have a strong menthol smell like some of like the normal Vicks, and it's safe for her. Uh, I would rub some on her chest and her neck area, and then I would rub it on her feet and cover her feet up with her onesie at night. And that helped her a lot. I can't take you in my room because I'm on my laptop, and my room is really messy, and that's where her bed is. But you can put rolled up towels or a wedge, a pillow under the mattress. And if they're coughing, you want to elevate them a little bit so that mucus doesn't pool in the back of their throat. That's another helpful way. Another way, and that's how I got her to sleep, and it was okay by my doctor, was I would put her to bed in her carrier. I wouldn't lock her in because I would put her in her bed, but I would pad up her carrier so she wasn't laying on her on the buckles, and then I would put her in there and I would rock her. That was really helpful because she was just didn't feel good, and so a lot of the time she just wanted the comfort of like a swaddle, but she didn't want to be in a swaddle basically. So besides the normal tips of warm steamy shower, menthol bath, or let her fight it out, that's what I would say of how to take care of a sick baby. A lot of the times it's a sit and wait, as I was told, and that's scary as a new mom. So I would suggest having those things on hand. I would suggest having patience, and don't freak out. Just take care of them and snuggle them, and that's really all they want. Now, a couple facts that I learned and it helped me relax a lot is RSV is common, like extremely common. 90% of babies get it before their first birthday, and especially more so if they're born in the colder months like December, January, February. And it sounds terrible. I know it does, and I thought it was terrible because all I've ever heard is a bad rap, and it should have a bad rap. Like babies have passed away from it, but it also is adults get RSV, and basically RSV is baby bronchitis. So if you don't watch it, they can develop pneumonia. So that's where that comes from. But that actually helped me a lot because I understood what bronchitis was, and RSV is something that you're like, I don't know what this is. Like, and they don't explain it very well in the hospital. But it's basically like fluid in the lung, like mucus or something like that. So that helped me a lot to understand what was going on, and it made me feel so much better. And she's perfect now. She's playing and having fun and totally hanging out with me. So, sick babies aside, let's talk about my products. So I was going to review the muslin blanket, the Wub Nub, and the amber teething necklace. I can't find my amber teething necklace, so I want to talk about that one first. But I have the other two so I can show you. I ordered my amber teething necklace from Amazon. It was certified 100% real Baltic amber. I put it on her for 2 weeks straight, and I put it off of her for 2 weeks straight to see if there was a difference. During the 2 weeks that it was on her, she like completely changed, and not in the good way that I had read reviews about. She became irritable and crabby and like didn't want to be put down, didn't want to be touched. Like she was conflicted with how she was feeling, and it was frustrating because I have this baby who is always very specific about what she wants, and then when it comes to this necklace, all of a sudden she's changed. And then when I took it off of her for 2 weeks, my baby was back. There was nothing wrong with it. It was like obviously an amber color. It had the knots in between the beads, and it was about the size of her neck. It rode about like collarbone line, so she never pulled at it, never picked at it. She barely even realized she was wearing it, but it did change her. And for that reason, she currently does not wear it because I don't think it benefits her at all, and she's not having an issue at the moment with teething or anything like that. Okay, so the next thing I want to talk about is the wub nub. If you don't know what a wub nub is, it's a pretty much a friend for your pacifier. Um, this is Raffy. He is the second wub nub I've bought and her personal favorite. She carries him around everywhere with her, and he's about, I don't know, like the size of my palm, and he weighs nothing. He's really, oh, as you can see, it builds good arm muscle. Her hand-eye coordination multiplied times 1,000, and it actually helped her with her self-soothing. Granted, she was good at that in the first place, but I decided to start putting her in her crib to sleep at night, and that not only was rough for me, but it was rough for her because she wasn't quite used to it. So that helped her with her self-soothing because she would grab it and just pop it in her mouth and go to bed. Now it's helping her. I don't know if you can see her, but she's literally chewing on the edges of it. It must feel good on her gums because she does this a lot. This is like her buddy though. This goes everywhere with her. It goes with her to daycare. It goes with her to bed. It goes with her on car rides. Like Raffy is everywhere. And I believe in them a ton. If you're a pacifier mom, I strongly, highly suggest the Wub Nub pacifiers. Um, they have the Avent, I guess you could call them, Advent pacifiers that you get from the hospital is like sewn to it. There's no way she could pull it off unless she's like super strong. I've tried pulling it off and I couldn't. There's like there's really no safety hazard with it. She chews on his feet a lot. She must really like that. It must feel good. And I would strongly, highly suggest that any mom who doesn't want to keep putting the pacifier back in baby's mouth to buy one of those. They will end up doing it themselves. And the next baby I have will have one of those as well. I would probably buy him or her their own so they can have a Raffy as well. And the last product I have a big one, I'm sorry, is a muslin blanket. And the muslin blanket is hard to describe. I know a lot of moms probably know a little bit about it. It's a super soft, like striated, textured material. And it's thin. It's really thin, but it keeps her really warm. I absolutely phenomenally love these blankets, and I got some as a gift from my best friend's grandma. Hi, Grandma. And she loves them. Like, they're my favorite blankets to use besides the ones that were made personally for me, like her cross stitch blanket and her crocheted blanket, which I use all the time. If those are for some reason dirty, these are the first thing I turn to. Now, she has one right now because my other ones are in the process of being cleaned. This one is a large one. Let's see if I can show you. Very, very large. And it helps keep her warm. It helps keep her cool at the same time. And it's just really soft without having all like the fluffiness about some of the other blankets. I would suggest this, highly recommend it for moms looking to find nice blankets that babies can have in the car, that they can take to bed with them. That to swaddle in, it's big enough to definitely swaddle and still have some room in. So it's a big yes all around. So yes on the Webnum, yes on the muslin. I totally love it. And I'm iffy on the amber teething necklace. I'm considering trying it again. So we'll see. So that's my review. Just a little bit more, I want to talk about Brooke. She's 7 months old now. I'm sure as you can see, she's watching her favorite movie in the whole wide world. That's Cloudy with a Chance of Meatballs 2. She doesn't sit up yet. She tries to army crawl. She has started eating more foods. We found she's allergic to strawberries, which is really common. So we're waiting for a year to re-give her strawberries. She talks more. She rolls over. I feel like her personality is really, really coming out now. Like she's turning into this cute little rambunctious, stubborn thing. And she's also eating like solids more. I'm like a baby led slash puree weaning. I'm combining the two of them. But this thing, they're her favorites. They're little crunchies, and basically they look like a Cheeto. And these guys are mixed vegetables. They have like a vegetable flavor to them, and I absolutely love them. As does she. Let's see if I can get her to do it. Brooke, hey. She probably won't. Brookie! Psst. Come here. Ooh. Oh, you dropped it. Ooh, there you go. The best part is since they are like Gerber for kids, they even have like the crawling stage on them. Granted, she's not in the crawling stage, but they melt. Like she has not had an issue with choking. She's actually improved her chewing motion a ton by chewing on these, and she's never choked. They just disintegrate in her mouth. So I really, really like those. She really likes tortillas. She really likes avocados. That's funny. She's not big on her fruit yet. We tried our first sippy cup, and it was kind of a fail. You get a really dirty face out of it. I'll have to show you a picture. But I just wanted to do my long video. I apologize for it being so long. The next ones will be shorter, and hopefully, as far as I know, I think Bree should be joining us back soon. So I'm excited for that. I'm also excited for some of the new things that's going to happen this year for us as our channel and individually for us both. So I will see you next week, most likely on a Friday. So bye.